Hey everyone. In this next episode, I chat with Spencer Hawkswell, the CEO of nonprofit organization TheraPsil, about Health Canada's recent decision to deny Section 56 exemptions to healthcare practitioners. Watch to find out what Spencer has to say. Hi, everyone, and welcome to the Dales Report. Today, we've got Spencer Hawkswell, the CEO of TheraPsil, on the show to talk about some news that we received yesterday. So Health Canada denied healthcare practitioners, Section 56 exemptions after granting them to a group in 2020. Definitely a confusing turn of events. Thank you, Spencer, for being on the show. So I wanted to ask first, what is the feeling right now at TheraPsil? How is the team responding? And what's the general feeling after this news?
Well, really, there are quite a few upset healthcare practitioners, about 130 of them that have been in the training program and passed the training program and are just waiting on these exemptions to come in so they can finish the training program with their experiential psilocybin sessions. And on top of that, there are about 1,000 other healthcare practitioners who are waiting to start the training. And then there are about 1,500 patients in our waiting lists that are depending on these trained healthcare practitioners so that they can be supported with Section 56 exemptions or SAP exemptions to psilocybin. So a lot of people are really upset. And I think the sentiment among everyone is that this decision is not a compassionate one, and it's lacks foresight. So that's what people are dealing with is they feel like they're not being heard. And that they're being ignored by Health Canada. And really, at the end of the day, they all understand who bears the consequences of this, patients.
Totally.
So it's not particularly good. However, the team, we've got a legal team and our advocates and a number of healthcare practitioners who are really leading the charge. There is a lot of optimism there.
That's good to hear.
And I'd say the reason for that is we know that Minister Duclos is going to make the right decision here. The health minister is the one who, at the end of the day, decides whether or not these exemptions get passed. And we all believe that Minister Duclos is compassionate and that he understands what's being asked here, is that healthcare practitioners can actually train with this medicine before they're working with patients. You'd be hard-pressed to find a single healthcare practitioner who would disagree with that.
Totally. Now, I want to ask, I found this really confusing because in December 2020, under a different health minister, we had exemptions that were approved for the same purposes. Was there any indication before learning the news the other day that this was going to happen, that the applications were going to be denied?
No, and to be clear, so Health Canada has written the letter of intent to deny, and then there's 14 days, and then it's official that it's denied, right? So there's actually a 14-day period, and that was the only, written communication that they had. Many people were ignored, right, for 300 days. Meanwhile, we're sending in letters, weekly to the minister and to Health Canada, trying to seek a quick resolution because patients have been continuing to get exemptions, and the only problem is they're kind of sitting there without trained healthcare practitioners to treat them.
Totally.
So there really wasn't any good communication, nor were we expecting this because we all exist in Canada under the same Charter of Rights and Freedoms, and Charter 15 rights say that we're all equal under the law. So why have we created two tiers of healthcare practitioners in this country? Those who get exemptions and those who get ignored and denied. It's irresponsible, and it's not in line with our charter rights.
Totally. So I want to ask a little bit about the bigger picture. Right now, we're talking a lot about, the needs for new solutions for mental health care. Can any of this actually happen if we don't have practitioners that are trained?
No, right? I think one of the biggest issues we've had here is communicating the fact that psilocybin is not a drug. It's a drug therapy combination when it's used therapeutically, right? There are some people who may use psilocybin to treat pain, such as those with cluster headaches. But for the most part, we're seeing people use their psilocybin in a psychotherapeutic context. And so we can't delineate from the best practices of psychotherapy. And something I would ask to the government, to Health Canada, is point to a therapist or anyone providing therapy who has not been through that therapy themselves. It doesn't exist. That's not the best practices. That's not how psychotherapy is done. And so similarly here, we have an army of therapists asking for the right to use psilocybin in training before they're going to be providing this therapy. And that makes complete sense. That is the way it's been done. I presume since Freud, and that's what's being asked for here. And the unfortunate thing is it's non-medical people, bureaucrats, that are denying this and making the decision against the best advice from hundreds and hundreds of psychotherapists, doctors, nurses, and researchers. So are we ever going to be able to safely and effectively treat medical patients who need access to medical psilocybin without trained professionals? I mean, maybe. But why would we opt for something half-assed, right? Let's allow these people to train. Let's make sure it's done safely and that the outcomes are positive.
Absolutely. I wanted to ask if this notice of intent changes anything as far as how TheraPsil is going to approach, patients and other healthcare practitioners that might also be seeking exemptions. What are you guys going to do next? Does this sort of throw a wrench into your plans or your process?
Not really.
That's good.
Not really. To me, what it does is it really shows the need for regulations here. And we've written regulations called the APMPR, so Access to Medical Psilocybin Regulations. It really is just showing that that's needed more than ever. Because if this is just going to be years and years and years of patients and healthcare practitioners constantly fighting bureaucrats to try and get them and their patients access to medicine, it's not going to work in anyone's favor. That's not a compassionate, it's not an intelligent way to deal with healthcare in this country. So what this is really showing us is that Health Canada's made their decision, that they're not going to listen and act in the best interest of Canadian patients and healthcare practitioners, and that we need to move to a regulatory system that is going to help, that is going to be more robust, more compassionate, and safer. So for us, it's kind of nice, right? The rubber's hitting the road. We've got 14 days to seek a decision from Minister Duclos. And if it's positive, it'll show that we're moving in the right direction. And if it's not, if it doesn't help these patients and healthcare practitioners, we are fully prepared, right, to take this to the next level, whether that's increased lobbying or court. So we do have a legal team that's been supporting us for the past couple of years, and we've got 130 healthcare practitioners as of Monday that are asking for legal help. So this is things are going to change really soon.
Well, it's definitely great to hear that you guys have solid backup as far as a legal team. Hoping to see some positive moves around this. You do say we've still got those 14 days, but really hoping for a positive outcome here. Definitely admire all the work that TheraPsil does. Thanks for taking the time. I know it was short. Spencer, is there anything else at all about this news, about the work that TheraPsil is doing that you want to add?
I think that's where we can leave it for now. The one other thing I might add is that there are a number of patients who have also received letters of intent to deny their exemptions. Some of them are palliative, and this is just this just echoes the problem with having bureaucrats deciding making medical decisions on behalf of doctors and patients. So I'm very, very optimistic that Jean-Yves Duclos and Minister Carolyn Bennett, that they're going to make the right decision. I think this is just a matter of getting their attention and seeking a response from them. So the outlook is positive. It really is, but we need the help of everyone in Canada right now to make sure that this doesn't get swept under the rug.
Well, thank you so much, Spencer.
So thank you very much for
awesome. Well, hopefully we'll have you on the show again soon. Cheers.